Welcome to The Explainer. Today, we're basically stepping into the shoes of a medical detective. We're going to investigate one of the absolute most fascinating and honestly complex puzzles in modern psychiatric practice. We're looking at two totally distinct conditions that, from the outside, can look like exact replicas of each other. Our mission? Well, we need to uncover exactly how medical professionals untangle the overlapping webs of attention deficit hyperactivity disorder and childhood trauma.
Okay, let's dive into this. If you see someone struggling with intense brain fog, unexpected emotional outbursts, and this sort of chronic physical restlessness, what are you actually looking at? Are you witnessing a brain with scattered focus and a structural neurochemical deficit? Or are you looking at a traumatized nervous system that's just exhausted from managing emotional pain? It's a profound question, and as you'll see, getting the answer wrong has huge implications. Section 1. The Great Symptom Overlap.
When we look at the diagnostic criteria for both ADHD and trauma, we essentially find this massive Venn diagram with a completely crowded center. Both conditions severely impact the brain's executive functioning center, that's the prefrontal cortex, and its alarm system, the amygdala. So what does this actually look like? You get severe inattention, chronic restlessness, really intense emotional dysregulation, and a genuine lack of impulse control in both cases. The outward behavior is literally identical, which creates this perfect storm for misdiagnosis.
And the stakes of this clinical mystery are absolutely massive. According to research out of Michigan State University, an estimated 1 million children are potentially misdiagnosed with ADHD every single year. 1 million. Many of these kids actually come from environments with chronic stressors, violence, or family dysfunction. That means their outward behaviors might really be rooted in trauma rather than a primary neurodevelopmental disorder.
Moving on to Section 2, Origins, Genetics versus Stress.
To understand trauma's brilliant disguise, we have to talk about toxic stress. When a child faces acute adversity without a supportive adult to buffer them, their body's fight or flight response basically gets locked in the on position. This prolonged flood of adrenaline and cortisol becomes genuinely toxic. It literally alters brain development and can even cause neuronal cell death in the prefrontal cortex and limbic system. And remember, those are the exact same brain regions affected by ADHD. And this brilliantly illustrates the fundamental difference at the root of our mystery. ADHD is neurodevelopmental, right? It's a structural dopamine deficiency that a person is born with. Trauma, on the flip side, is experiential. It's the brain and body's exhausted, dysregulated response to an overwhelming or distressing event. So you have one nervous system that is starved for stimulation and another nervous system that's trapped in this perpetual state of hypervigilance. Which brings us to Section 3. Spotting the hidden differences.
So how do medical professionals figure this out?
Well, they have to look really closely at timelines and environments. ADHD symptoms are pervasive. They've been there since early childhood and generally show up everywhere. But say a patient had a really calm, focused childhood and then suddenly develops severe concentration issues at age 25 after a car accident, that points heavily to trauma. Plus, trauma symptoms tend to fluctuate based on environmental triggers, whereas ADHD symptoms maintain a much more constant baseline. We can also reframe how we look at the specific behaviors themselves, like distraction. In an ADHD brain, distraction is totally scattered. The mind jumps from answering an email to folding laundry to researching some random facts online, all because it's actively hunting for dopamine. But a traumatized brain is highly specific in its distraction. It isn't looking for stimulation at all. It's monitoring the mood of the room, listening for footsteps, and constantly scanning the environment for danger. We see a really similar contrast with restlessness, too. For someone with ADHD, restlessness feels like being driven by an internal motor. It's a physical, structural need to move and stimulate the brain. But trauma restlessness? That's an active flight response. The person physically cannot sit still or relax because their nervous system is absolutely flooded with adrenaline, falsely believing they're currently under attack.
All right, Section 4, the comorbidity puzzle.
Now, what's really interesting here is the sheer scale of the overlap. It's staggering. Research indicates that adults with ADHD are nearly 7 times more likely to have PTSD than those without ADHD. 7 times. This isn't just some wild coincidence. There's a deep structural connection between living with ADHD and the likelihood of experiencing trauma. Think about the cause and effect relationship going on here. Growing up with undiagnosed ADHD often means enduring constant criticism. Things like, why can't you just try harder? It involves social rejection and chronic academic failure. Over time, this built a devastating foundation of little t trauma.
On top of that, the impulsivity and poor risk assessment associated with ADHD mathematically increase a person's odds of experiencing big T traumatic events, like severe accidents. The ADHD brain is just uniquely vulnerable to trauma.
Let's look at Section 5, getting the right treatment. Here is the very real danger of misdiagnosis. If a patient's primary issue is trauma, treating them exclusively with ADHD stimulants can backfire terribly. Stimulants naturally increase heart rate and alertness, right? Well, for a nervous system that is already sensitized and traumatized, these medications can inadvertently trigger severe agitation, throwing the patient right back into a full-blown panic attack. It's a scary situation.
Conversely, it's absolutely vital to remember this. No amount of processing will fix a structural dopamine deficiency. If a patient genuinely has ADHD, treating them solely with trauma talk therapy is going to be endlessly frustrating for them. You can do all the emotional processing in the world, but it will never, ever fix a structural neurochemical dopamine deficiency in the brain. They need targeted ADHD support to actually function. Let's move to our treatment plan and see how this builds a clear path forward for those dealing with both conditions. Clinicians use a dual-track approach. Step 1 is always stabilization, making sure the nervous system feels safe. Then they use trauma-informed therapies like EMDR or CBT. Finally, careful medication management is introduced. The medication provides that cognitive scaffolding that actually allows the patient to focus on and participate in their trauma therapy. For educators, parents, and medical professionals, safeguarding these individuals really relies on the 4 R's of trauma-informed care. We must realize the widespread impact of trauma, recognize the signs rather than just writing them off as bad behavior, respond by integrating this knowledge right into our practices, and actively resist re-traumatizing the child. Doing all of this creates an environment that actively buffers toxic stress. So the crucial point is this. The next time you see a child or even an adult who is chronically restless, disorganized, and just unable to focus, I want you to pause for a second. Are we looking at a broken focus, or are we actually looking at a broken sense of safety? Understanding the difference changes absolutely everything about how we help them heal.